Welcome back and thanks for staying with us. Let's now take you back to our story that we are going to speaking around, of course, HIV and AIDS. In over 4 decades since the AIDS epidemic burst into the global scene, it has killed more than 42 million people now, whilst AIDS-related deaths have been steadily declining, falling from 670,000 in 2022 to 630,000 last year. The numbers still remain very high. Let's now take this discussion further regarding children living with HIV and AIDS. We're now joined by Humile Mashatile from the Global Alliance to End AIDS. Good afternoon to you. Let's see if we can get you on the line now. So, of course, I mean, whilst South Africa has been lauded and praised for just making these strides in the fight against HIV and AIDS, it is still concerning, particularly when we speak about children. I mean, the number of children under the age of 14 still being infected, with HIV. What do you think are the key drivers?
Thank you so much. Some of the key drivers that we're seeing actually between the ages of 10 and 14 is socioeconomic factors that are affecting our children. I mean, most of them come from impoverished neighborhoods and communities. So they find themselves being infected, or rather being sexually active, because of the dynamics that they live in. Others would have been on treatment, or rather not knowing their status because of various reasons. So it's quite imperative that as and when children get sexually active, even at school, that they do get educated about their sexuality and actually promote them to be able to go get tested as soon as they do become sexually active, so that they can be able to eliminate and actually prevent themselves from being infected.
And I know in South Africa, of course, when we talk about children under the age of 14 being sexually active, most of the time we find that those children are actually being raped. I mean, we know that in schools that, children last year, 2 years ago, I think thousands of children from across the country, being impregnated at a very young age. Is this also part of the problem? And is law enforcement also just taking its role in this point in time? Because I would imagine that it just goes beyond children that are sexually active at this stage.
Absolutely. Hence, I highlighted that it's a socioeconomic issue whereby most of them are being raped. Absolutely. And yes, the law enforcement is part of the team that in South Africa that we actually interact with as to what are we doing and do they report these incidences. And after they've been reported, are the parents involved? Because that's the other issue that we're also finding as we go to communities, that some of the parents are not actively involved in terms of taking action and reporting these matters, ensuring that the kids get the necessary health care after they've reported and being raped. So it's really an integrated communication and whereby all parties need to be part of ensuring that we end AIDS by 2030, including the healthcare practitioners as well. They need to be able to understand and be capacitated as to how to be treating young children, because they're still children at that age, as to how then to be able to deal with them and ensure that they put them through the necessary, be it could be PrEP or whatever preventative measures, be it could be a contraceptive, or actually ensuring that also they do testing after they get they've been raped. So it's really...
Yeah, I would imagine that, hospitals and just general health care is also in the spotlight in as far as advancing that is concerned. But you mentioned the vision of 2030, and I want to just talk about the AIDS conference that's currently taking place in Germany. Of course, we know that, calls have been made that developed countries being urged to assist developing countries, with state-of-the-art technology that will aid somehow in treatment. I mean, how can technology, in your view, assist in the eradication of HIV/AIDS, or at least in the fight against the scourge?
Yes, you're right. We're having a conference in Germany, in Munich currently, where various research actually have been found in terms of what mechanisms we can be able to improve in our healthcare system, so that we're able to detect HIV/AIDS early within children and also within breastfeeding mothers, as to how best can be able to combat the vertical transition between breastfeeding moms and children. So this research, of course, can enable us to be able to improve how we are able to implement and to end AIDS by 2030 within the healthcare system. Together, of course, I mean, we ensure that we work with the necessary departments, Department of Education, but also the community leaders as well, that it's not just the research that is done, but also that all these plans can be implemented by community leaders and as well as the local healthcare practitioners.
To what extent would funding, because we understand, of course, that it has dropped significantly over the years, to what extent would it help advance, the fight against HIV and AIDS, particularly when you look at South Africa and sub-Saharan Africa?
We absolutely do need funding, actually. We've been funded by the UN agencies, the UNAID, UNICEF, WHO, the Global Fund. But of course, I mean, in order for us to see the difference that we want to obtain by 2030, we do need the private sector to come on board in order for us to be able to, currently South Africa has the largest numbers of children with HIV/AIDS. So in order for us to be able to reach our target, we need the private sector to come on board to assist our community, the healthcare system and communities, because ultimately these children belong to us. They belong to our society, and ultimately they will go into the workplace, tertiary education, and be part of our, interactive community. So how best then do we ensure that we eliminate and actually decrease the numbers that we currently have, so that our communities also, so that our children can be able to thrive and live a life that they ought or dream of. So definitely the private sector is needed, and of course different companies and organizations, so they can be able to work together in order to eliminate the surge of HIV/AIDS in children.
Humile, thank you so much for your time. Really do appreciate it. Of course, Humile Mashatile from the Global Alliance to End AIDS in Children by 2030.